Ever heard of hypoglycemia? It's when your blood sugar level gets too low. It's usually linked with diabetes, but it can happen to anyone. Today, we're talking about the signs and symptoms of hypoglycemia. Do you ever have trouble seeing clearly, or do your bad dreams seem to get worse? Can it even cause seizures? Stick around as we explore all these questions and more. Number 1, night sweats. Regular sweating can be uncomfortable, but sweating while in bed can be really scary. Night sweats, also known as nocturnal hypoglycemia, happen when your blood sugar drops while you're asleep. This sugar is like the fuel that keeps your body running smoothly. Several things can cause your blood sugar to drop during the night. For example, if you drink alcohol before bed, your liver might not make enough sugar, leading to sweating. Similarly, exercising a lot right before bedtime can use up your body's sugar, causing sweating too. Night sweats can seriously mess up your sleep. Imagine trying to fall asleep with your pillow all wet. And it's not just at night. Low blood sugar can make you sweat during the day too. If you're just sitting in a room with a normal temperature, low blood sugar might make you start sweating. Medical experts say sweating is a symptom of mild low blood sugar, which means your level is below 70 milligrams per deciliter. Number 2, blurry eyesight. Another worrying sign of hypoglycemia is when your eyesight becomes blurry. This can happen quickly or over time. In the short term, high blood sugar levels can make fluid move into your eyes, causing them to swell and your vision to blur. This usually gets better once your blood sugar level drops. But if your vision stays blurry for a long time, it could mean your blood sugar levels are changing too much. This can harm the blood vessels in your eyes and damage your retina. Number 3, feeling hungry. If you have hypoglycemia, you might feel very hungry, even after you've eaten. This happens because your brain is telling you that your body needs more glucose. To manage low blood sugar, it's important to eat meals that balance your glucose levels. This means eating foods that are rich in carbohydrates. Carbs turn into glucose in your body. When you feel extremely hungry due to hypoglycemia, health experts suggest having dried fruit and juice to help raise your blood sugar levels quickly. Number 4, feeling worried. These days, it seems like everything can make you feel worried. Just living life can leave you feeling uneasy. Well, add hypoglycemia to the list of things that might cause worry. Low blood sugar is known for triggering strong feelings of anxiety. When your levels drop, your body releases a hormone called epinephrine, which is responsible for adrenaline. This can make your body react anxiously as a way to protect itself. It can be hard to tell if your worry is from low blood sugar or from other reasons, especially if you often feel worried. If you're feeling worried and don't know why, it's a good idea to talk to a healthcare professional. Number 5, feeling dizzy. Feeling dizzy is another scary symptom of low blood sugar, just like blurry vision and anxiety. Many of us have stood up and felt wobbly, especially if we get up too quickly. If this happens to you a lot, it might be a good idea to check your blood sugar level. Low blood sugar can make you feel confused and unsteady. Sometimes you might even feel hot all over. If you often feel dizzy, it's a good idea to see a doctor. You never know when you might faint suddenly. Number 6, difficulty talking. Having trouble talking is something you might experience when your blood sugar is very low. Basically, if your brain doesn't get enough sugar, it can affect the way you speak. It's like trying to have a chat, but your words come out all mixed up. People might even think you've been drinking because your speech sounds unclear, but really it's just because your blood sugar is too low. Number 7, difficulty concentrating. When your blood sugar levels drop, it's not just your words that start to stumble. It becomes a real challenge to pay attention to anything. It's like trying to grab hold of a slippery fish. The harder you try, the more it slips away. This happens because your brain isn't getting the energy it needs from sugar, so your thoughts get all muddled up. If you're finding it tough to concentrate because of low blood sugar, it might help to snack on something with steady carbs. That can give your brain the quick energy boost it needs to start working properly again. Number 8, emotional roller coaster. As if struggling to concentrate wasn't enough, low blood sugar can also mess with your emotions. One moment, you're feeling as chipper as a chirping bird, and the next, you're as grumpy as a bear with a sore paw. It's like being on a roller coaster ride of feelings. So, if you're finding yourself swinging from one emotion to another without any clear reason, don't brush it off. Low blood sugar might be the sneaky culprit behind your sudden mood changes. Number 9, terrifying nightmares. You're peacefully sleeping and suddenly you're thrown into a nightmare. That's what can happen with hypoglycemia. These aren't just your regular bad dreams. They can be intense and vivid, like fleeing from a menacing creature, or they can be subtle but unsettling, like worrying about something important. Whether they're spine-chilling or just unsettling, waking up from these nightmares in the dead of night can leave you feeling uneasy and disoriented. If you find yourself frequently jolted awake by these frightening dreams, it might be worth mentioning to your healthcare provider, as it could be a sign of underlying issues that need attention. Number 10, trembling and shaking. Have you ever experienced sudden trembling or shaking seemingly out of nowhere? It could be your body's way of alerting you to low blood sugar levels. When your glucose levels drop, your nervous system goes into overdrive, releasing chemicals that cause your muscles to tremble involuntarily. This shaking sensation can be uncomfortable and alarming, but it's your body's signal that it needs help restoring balance to your blood sugar levels. If you notice these tremors occurring frequently, especially alongside other symptoms of hypoglycemia, it's essential to speak with a healthcare professional to determine the underlying cause and receive appropriate treatment. Number 11, seizures. Seizures are one of the scariest symptoms of hypoglycemia. They can happen suddenly, leaving you feeling completely out of control. For people with diabetes, seizures are a serious concern, especially if they've taken insulin or certain medications. These seizures can be so severe that they lead to a coma, which can be life-threatening if not treated promptly. If you've ever experienced a seizure or worry about having one due to low blood sugar, it's essential to seek medical advice. Your doctor can help you manage your condition and prevent future episodes. It's important to always carry a quick source of glucose, like candy or juice, to help quickly raise your blood sugar if it drops too low. Stay aware of your body's signals and make sure to follow your doctor's advice closely. Do you or someone you know have hypoglycemia? Have you ever had any of these problems? Tell us about it in the comments. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more useful stuff. And check out our other videos too. Stay healthy, and thanks for watching.